Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you so much for joining me and joining us. I'm joined in the studio by Caitlin Kirby. She is a public health nurse in the city of Quincy. And Caitlin, welcome back.
Thank you. Always happy to come back.
Always great to have you. Today's topic is a foodborne illness. It is kind of a group of, I suppose, viruses called norovirus.
Yes. So as we get into this, so it's neuroviruses because again, it's like a group of them. But I will mostly be just referring to it as singularly neurovirus as we go forward. But it's very common. So I just wanted the audience to be aware of what this foodborne illness is and preventative measures to help protect themselves.
Oftentimes, it's referred to as the Norwalk virus.
Yeah, so there's like many different names. It's like the Norwalk virus, Norwalk-like viruses, or it can also be known as calcaviruses. But in just general terms, we'll just refer to it as neurovirus to cover all of them.
Gotcha. Absolutely. Okay, let's look at an overview so you know what to expect. We will talk first about definition. What is a norovirus? We will talk about symptoms. How are noroviruses spread? Who is at risk for infection? Diagnosis, treatment, restrictions for individuals diagnosed with noroviruses, prevention, and then resources to find out more information. So it's always great to start at the beginning. And with that said, let's start with definitions because that will kind of set the stage.
Yeah, so with these neuroviruses, it's a group of germs that cause gastrointestinal illnesses or GI illnesses. And this is due to an inflammation of the stomach lining or intestines. And it's just where the many different names of this virus. This germ is typically like small and round structured. And the virus is actually named after the original strain that caused an outbreak in schools in Norwalk, Ohio back in 1968.
There's the Norwalk connection.
Yes, yes.
68, that's the year I was born.
Yeah, I know you always love to know the origin of the name.
I do. And you always bring that to me, so thank you.
Of course.
So symptoms, what are some of the most common symptoms?
So the most common symptoms we see, nausea, vomiting, diarrhea, abdominal cramps, and then some other symptoms people may experience, headache, fevers or chills, and muscle aches. So typically the incubation of this virus, symptoms usually will begin 1 to 2 days after you're exposed to the virus. And the duration of this illness, typically your symptoms will only last 1 to 3 days. And for most people, there are no long-term side effects by any means. If you have norovirus illness, you may feel extremely ill and vomit or have diarrhea many times a day. So it's just important to know that this can lead to dehydration, especially in young children or older adults. So you want to make sure that you're staying hydrated. And this goes for any time you have diarrhea or vomiting, because you think of that, basically your body is losing all of that fluid that it should be absorbing. So children who are dehydrated, they may cry with few to no tears and may be unusually sleepy or fussy. Other symptoms of dehydration, you would have decreased in urination, dry mouth or throat, and feeling dizzy when standing up. So really make sure that you're staying hydrated anytime you have nausea or diarrhea.
So here's the thing. So when you're sick, when you feel sick, it's very difficult to I suppose, you yourself or for you to tell somebody else to drink.
Yes.
But you or someone else really just needs to sip drink. They don't have to guzzle.
Yes, because a lot of times if you like have a glass of water, if you chug it, that can, especially if you are nauseous and vomiting, that could induce you to vomit that right back
Absolutely.
up.
Right.
So taking small sips is pretty much preferred. There's also tons of different brands out there, especially for children, where they have different popsicles. I love freeze pops myself. So there's different avenues to get fluids as well. So just make sure if you are experiencing a foodborne like illness or vomiting and diarrhea that you're monitoring for dehydration, because that could become very severe. If you notice yourself, a loved one, or a child is experiencing dehydration, you call the doctor to make them aware and monitor them, because if it becomes severe, they might need hospitalization for IV fluids.
So how are noroviruses spread?
So norovirus must be swallowed to cause an infection. So the virus is passed through the stool and vomit of an infected person from the day they start feeling ill up to 2 to 3 weeks after they feel better. And so it's typically spread by eating or drinking contaminated foods, or those foods or drinks are prepared by someone who is infected or is in close contact with someone who is infected. And then there's also another way you can get it. Some foods such as oysters or berries can be contaminated with norovirus before they're delivered to the store or restaurant if they come into contact with contaminated water. So I'll go into this a little bit when I get into my restrictions.
So I suppose with berries, if you bought berries, washing them at home, if you had control over prepping the food, washing them at home would take care of that.
Yes, typically you want to make sure you're washing them thoroughly.
Can't really wash oysters.
Yes. So when I get into the restrictions, I'll kind of go over how the local Board of Health, myself as a public health nurse, how we're involved. But a lot of times if somebody is diagnosed with a I shouldn't even say a lot of times, every time, when a person is diagnosed with a foodborne illness, that doctor or testing facility has to report it to the state health department, who then reverts it to the local Board of Health. We get notified and we do an investigation. So we would contact to make sure if somebody is diagnosed with this, that they don't work with food, that they're not in a restaurant. And we would restrict them from working until they're better, to help reduce the spread of the virus.
Who is at risk? Often you hear that this might break out on a cruise ship. So my first thought are travelers.
Yeah, so really anybody's at risk. Older children and adults may be more likely to get more severe symptoms. And it's important to know that, like, even when we went into the definition before we even got there, we mentioned all the different terms and types of viruses that go with norovirus. Because there are so many strains, people can get sick many times in your lifetime. You wouldn't develop immunity after being sick. I do want to circle back real quick. I did miss under my how you can get sick. Touching surfaces or objects that are contaminated, and then putting your unwashed hands or fingers in your mouth, that can also cause the norovirus.
Right, I'm glad you mentioned that because I missed that too. But that leads me to, I guess, not only include the mouth, also include the nose, the eyes. Rubbing your eye would have the same effect. The infection would get in that way as well.
Typically, yes. Typically, like typically you'd have to swallow it. So the risk could be a little bit lower for your eyes.
Oh, okay.
I'm not exactly
And
sure.
is this only for norovirus?
Just for the norovirus, yes. Because typically you have to swallow this virus for it to be to get infected with it. But it's just important to know. Make sure you're washing your hands very thoroughly before you eat, before you touch your face. I think that's one thing we all kind of learned from the pandemic that we went through, is how dirty your hands are on a day-to-day basis. So make sure you're practicing good hand hygiene.
Let's look at diagnosis.
So norovirus is actually very difficult to detect in a laboratory, but it is found by testing the stool or vomit of an infected person. Only a few laboratories actually perform this test, so it's usually only done under special circumstances. And according to the Massachusetts Department of Public Health, typically, the healthcare providers will first try to rule out other germs that may have caused the illness, and then base their diagnosis on symptoms and how long they last. I was inquiring with my coworker, who is an epidemiologist who also works in a lab. She was just mentioning with a stool or a vomit specimen, how hard it is to isolate a single virus within those specimens. So that's one of she had a lot better way of explaining that, of course. But that's just kind of, it seems to make sense if you think of a stool specimen or a throw-up specimen, just how many different organisms are within that. So
Absolutely.
It's hard to isolate.
I guess one of my questions is, I used to call this the 24-hour flu or the 24-hour virus. How is that different from norovirus or noroviruses? The flu is not a norovirus, is it?
No, so the flu is not a norovirus. It's just a different type of strain of a virus, basically. But a lot of times, people with norovirus, where the symptoms only last 1 to 2 days, they stay home and they treat it at home. So there is no lab testing or any of that. So it could be part of the reason why we do see this spread, because people aren't seeking help always when they are experiencing these symptoms. But just how it's different than the flu virus, it's just a different strain of a virus.
And treatment, there's no specific treatment for norovirus. So does that basically, is the path that one would go just to kind of let it play out?
Yeah, so with viruses, of course, antibiotics cannot work on a virus. So really, a virus just runs its course within the body. And without medication, typically individuals would be better in 1 to 3 days, depending. But again, I just want to mention that risk for dehydration. Make sure you are monitoring for that, because that could become life-threatening. So make sure if your symptoms are persisting or worsening, contact your healthcare provider. And working at a local board of health, we do have individuals that will call us. They'll go to a restaurant here in Quincy. Within 1 to 2 days, they're having all these GI issues, the vomiting and diarrhea. And without going to a doctor, they just call us to report it. So as a local board of health, we still follow up on that. As a nurse, I obtain all the clinical information, what they ate at the restaurant, and so forth. And then I provide it to our food inspector, who would then go and do an inspection for the restaurant, just to make sure no one's sick at the restaurant and that they're preparing all of the food correctly.
It doesn't seem like, I know this goes back to 68.
68, yeah.
But it seems like the topic norovirus has not been in the news until fairly recently. You didn't hear about it a lot as a norovirus or noroviruses.
Yeah, so a lot of times it typically only hits the news when there are major outbreaks.
And like you hear sometimes on a cruise ship, for example,
Yes.
right? Maybe in an enclosed area.
The cruise ship, you think of how quickly that can spread, especially if you can be spreading it. So if the cook is sick for 2 days and then they're feeling better and they go back to work, they could still be spreading it
For
for
2 to
3
3
weeks.
Right.
So if you think of a cruise ship, how small that is, and it's the same population eating the same meals and so forth. So it can spread a little quicker in a setting like that.
So that's why you hear about it on cruise ships, because it's really about the space, the confined
Yes.
space.
And if there are outbreaks, typically they would be put on the news. Like, say they're linked to berries or so forth. The state would then do a full investigation to figure out what berries, the specific brands, and release that to the general public to help. Again, all our goal is to reduce an outbreak and reduce the number of people that get sick.
When you mention the news, you hear often that there are salmonella outbreaks.
Yes. So very, very similar to norovirus. It's just
Okay.
a different type of foodborne illness that we see. But working all of these foodborne illnesses, we go through a very similar approach as a local board of health in investigating the disease to, again, cut it down and hopefully limit the spread.
So restrictions for individuals diagnosed with noroviruses.
Yeah, so since noroviruses are very contagious, again, the healthcare providers are required by law to report it to the state health department, which is then reverted back to the local board of health for an investigation. So any Quincy resident that gets a positive diagnosis for we do this for any communicable disease. So this goes for tick-borne diseases, foodborne diseases. We obviously did COVID. And we perform an investigation. So here in Quincy, we have a nurse that reaches out to the ordering provider and also the diagnosed case. We would get their information. I do want to state just on this episode, this all remains confidential. A lot of times when we're making the call from a local board of health, the individual is like, how do you know that? Like, because they go to their healthcare provider and then next thing they know, an outside source is calling them about their diagnosis. It is all confidential, but we are obtaining this information for the general public, basically. But we keep that individual's identity safe, and it's all under HIPAA, of course. But what we do, we look at clinical information and risk factors such as travel or food history for the previous 72 hours prior to this illness onset. The 72 hours is specific for norovirus. We have state guidelines that we follow, so if it is a different foodborne illness, the incubation times can be different. So we go by the state regulations to determine how long we're looking to investigate for. To protect the public, workers at food-related businesses must stay out of work for 72 hours after their symptoms resolve. But it is important to know if it's an outbreak situation. So if we have, I believe it is 2 or more or 3 or more individuals linked to the same, say it was a restaurant or a grocery store or so forth, we would have to have the food handling employees provide a stool sample prior to returning to work. So it has to be a negative stool sample. We don't obtain that ourselves at the local board of health. We would refer you to your provider to do that testing, but we're mandated to follow up on it and make sure that we're receiving the results. because we collaborate with the state health department who's overlooking all of this. And I did want to mention, I keep mentioning these food handling employees, so I automatically think of a restaurant. But in Massachusetts, this law also applies to workers in schools, residential programs, daycare, and healthcare facilities who feed or give mouth care or dispense medications to clients or patients. So a lot of these foodborne illnesses, even with our child care, you think of it, if it is an infant that's diagnosed with norovirus, you want to make sure the employees, if they're changing the diaper, that they're washing their hands thoroughly before they go and feed another child.
Sure.
So really, as a local board of health, we're very much involved in just making sure, again, these people know their diagnosis, they know how easily contagious it is, and how they can protect themselves and those around them. Yeah.
And that gets us to prevention. And the second item on the list, ensure food preparation areas are clean. Well, that's fine at your own home, but that wouldn't work in a establishment such as a restaurant.
Yes, and I would like to say, so like all restaurants are regulated by the local board of health. There are annual inspections, and then there are inspections based on complaints. So our food, we have here in Quincy, we have 3 food inspectors, and then we also, some of our housing inspectors, they will double as a food inspector because we do have a lot of restaurants here in Quincy. So it's important to know, when you are going out to a restaurant, that place is being inspected, and there are certain regulations in Massachusetts that they have to abide by. But obviously, mistakes can be made. People can be sick
Right.
and might
If an
not
employee
know it.
comes into work that shouldn't be coming into work because he or she is sick, there lies the
Yes.
problem.
Because especially, as I had mentioned with norovirus, people are sick for one or 2 days. They're like, oh, that was weird, that's over. And so they just continue to go back to work without ever getting tested. So they don't know that they're spreading anything. So unfortunately, you're always taking a risk. But it's just important to know that you can, if you do get sick after eating somewhere, check in with your local board of health and just have them do an investigation just to help if there was an incident or there was an employee that was really sick and didn't realize what they had. It's just important that it's caught so you can help reduce the risk to anybody else.
Which brings us to the most important point on the list. The first one, wash your hands.
Yeah, so you want to wash your hands thoroughly with soap and warm water before eating or preparing food, after using the bathroom, and after changing diapers.
And before, I'm going to stop you there because there is a time limit, if you will, or there is a suggested time that one should wash their hands.
Yes.
And if they're uncertain, they can sing a certain song.
Yes, two rounds of happy birthday as you're washing, and make sure you get it in between your fingers, under your nails, and really scrubbing your hands very thoroughly. They do say if you're out and about, like say you were at a park, hand sanitizer can be used, but it's not as sufficient as soap and warm water.
Because I basically think it just provides kind of a film so the viruses can't adhere to your skin.
Yeah, so I don't know exactly the exact way sanitizer works.
Right.
But I always say, like, if you're out and about and that's all you have, use it.
It's better than not using anything at all.
But definitely if you're at a park and then you're going home to prepare dinner, make sure, even if you use that hand sanitizer, wash your hands again before you touch your dinner.
Because that's the best way with soap and water, warm
Yes.
soap and water.
Yes.
Cook food completely.
make sure you're cooking all of your meals thoroughly. There's way too many, like I know if you look up, everything's so accessible now online. Like if you're cooking chicken or you're cooking steak, there are certain temperatures that it has to reach. So make sure you're using a thermometer, and if you don't know the certain degree that it's supposed to be, look it up before you just go ahead and eat that. Also make sure you're washing your fruits and vegetables thoroughly.
Which also brings up sushi, and of course you don't cook sushi, so I guess that's a risk you take if you ingest sushi.
Yeah, so there are foodborne illnesses that can be linked with sushi. Again, the restaurants that are serving it and like the grocery stores that are serving it, they are mandated by certain protocols to make sure that they're keeping that fresh and healthy, and hopefully limiting the risk of a foodborne illness being spread through that. Just make sure that if you do get sick, as a public health nurse, I advise you to seek medical help. Just go to your doctor, and that helps limit the spread to anybody else, God forbid.
When traveling to an area that might be contaminated or might have contaminated water, drink bottled water. That's preferred.
Yes. So when I was looking at the CDC for this information, they said preferably carbonated beverages. I wasn't able to figure out why carbonated versus a normal bottle of water. But it's also important not to use the ice. Because if you think about it, the ice like out of a vending machine or wherever you're getting that ice, that is typically made by the local water. So it's not just the drinking tap water, it's also in that ice. After episodes of vomiting or diarrhea, make sure you're cleaning contaminated surfaces immediately with a bleach-based household cleaner. There's so many different cleaners on the market, so just make sure when you are purchasing one, I know a lot of them, if you go to the store, they'll say right on the bottle, kills this virus and so forth. Make sure you're reading the labels and utilizing that the way it should be used.
Because there's a lot of sheets now. When you go to the market, you can get kind of a, almost like a pop-up wipe.
Yes. Yeah, so even like Clorox wipes, like I'm very big on those in my house. They're just very convenient. Just make sure you know what cleaner you're using and how to properly use that. And then same thing if you're taking care of a loved one who's sick, whether it's a child or your grandparent, make sure you're washing your hands and you are still cleaning. And then I know I've mentioned this, but remember, if you or your child has persistent diarrhea with or without a fever, or very bad diarrhea, call your healthcare provider for advice.
And we have 1 minute left. We'll look at resources to find out more information.
Yeah, so everything that I just covered, I obtained for the Center for Disease Control and Prevention, or CDC. And then also the Massachusetts Department of Public Health, which is mass.gov. And for both of those websites, you just look up neurovirus, and all of this information will be available. If you want help finding that information or more thorough information on it, you can reach out to your local Board of Health, and I'm sure the nurse or the investigator would be happy to either mail it or send you a copy of it.
Very good. Another great program. Thank you so much for your time.
Thank you for having me.
And thank you at home for watching. And just please remember to support your local Access TV station in the community in which you reside.